Today I am telling you something about the septoplasty. Septoplasty is a surgical correction of the deviated nasal septum. The nasal septum is made up of bone and cartilage, and it is situated between the two nasal cavity. I would like to say you the causes of the deviated nasal septum, and one of the most common cause is injury to the nasal bone. The second cause is a genetic cause. If the parents are having the deviated nasal septum, there are high chances of deviated nasal septum should be in the children also. The third common cause is birth trauma. At the time of birth, there may be an injury of the septum and causing the deviation of this bone. Now I just want to tell you the symptom of the deviated nasal septum. The most common symptom of deviated nasal septum is nasal blockage. Along with this symptom, there may be also a facial tenderness, facial pain, and the bleeding. So how we can correct this nasal septum? There is a surgery called the septoplasty. With the help of septoplasty, we can correct the deviated nasal septum. Now I would like to tell you what is the difference between my technique and the normal technique. I do the septoplasty without pain and without pack. In my surgery, the patient doesn't have any kind of pain inside the nose, and I don't put the pack in the nasal cavity. So immediate after the surgery, patient can breathe properly inside the nose. The patient doesn't have any kind of pain, the patient doesn't have any kind of bleeding. If suppose you are getting the conventional septoplasty, so if you are getting the conventional septoplasty, the patient having the nasal pack inside the nasal cavity, there will be a swelling, there will be a bleeding, and there will be the patient cannot take meal properly after the septoplasty, because every surgeon put the pack inside the nasal cavity after the surgery. So patient has to take the breathe as well as the meal through the mouth. So this is very inconvenient situation for the patient. So in my pain-free packless septoplasty, patient doesn't have any kind of feeding problem after the surgery, patient doesn't have any kind of bleeding, patient doesn't have any kind of pain after the surgery. So this is called as pain-free packless septoplasty. And I also would like to tell you something about the recovery. After the septoplasty, the patient can be discharged on the same day. After the patient has to restrict the normal activities like the intense exercises, weightlifting, running. These things should be avoided. Why? Because just because of this activity, there will be a rise in the blood pressure, so there are high chances of bleeding there.